A former health official for multiple Republican governors is sounding the alarm about a potential increase in child hospitalizations that could overwhelm Tennessee's hospital system and others in the region. He says on Facebook, regardless of how individual parents feel, our lives require vaccinations in schools, car seats for infants and toddlers, seatbelts for kids, and we don't let parents decide not to do these things because their freedom is being infringed upon. Joining us now is Levine, Chairman and CEO of Ballad Health in Tennessee. He served as Secretary of Louisiana's Department of Health and Hospitals, as well as the Senior Health Policy Advisor to Florida Governor Jeb Bush. You've been everywhere in all these hotspots, playing key roles. I want to get to what you wrote on Facebook because it's getting a lot of attention. But first, the FDA very possibly granting full approval to the Pfizer vaccine today. How much of a difference do you think that will make?
Well, John, good morning. I think Elizabeth is right in what she said. It doesn't change much in terms of the fact that we've had the vaccine out there, but now one of the biggest reasons we don't want to get vaccinated, certainly in our region, only less than 40% of the people are fully vaccinated, is that they're concerned that it wasn't approved by the FDA. So certainly, if the FDA approves it today or this week, we will do everything we can to educate people that it's now fully approved and that they should reconsider whether or not to get vaccinated.
Alan, I read your Facebook post with interest. And again, you have been everywhere down in these states that are key hotspots. And it really does sound like you're concerned about kids. What's your concern?
Well, there's several issues. First of all, as children are back in school, here in our backyard today, we have a school system that's closed because there's not enough teachers or bus drivers. And that's because of the virus. And as kids have gotten back into school, we've started to see an increase in the volume of children. More than a third of the positive tests that we're doing now are children under the age of 18. And as that continues to happen, and they're spreading it in schools, some of them are bringing it home to their families. Just since Friday, our census of COVID inpatients has gone up 20%. Our ICU census is up to almost capacity right now. And so kids are spreading it and bringing it home. Secondly, we because of the sheer number of children that are now being exposed, we're going to see an increase in the number of ER visits and the number of admissions. We now have up to 7 children this morning in the hospital. 2 of them are on ventilators right now in the pediatric intensive care unit, which is terrible. And then third, the thing that we're concerned about is with the spread of RSV and para-influenza that's happening now with COVID on top of it. What's going to come in the next 6 to 8 weeks is what's called multi-system inflammatory syndrome, where children, which can be deadly, and it needs to be treated in a hospital. And I shared those symptoms that parents should look for on my Facebook post. But what the CDC has said, they don't necessarily understand how this is happening, but they do see that children who have been exposed to COVID-19 tend to be the ones that end up with MIS-C. And so we obviously have concerns. The system of care for children in the United States was not built for this type of surge. There's only 5 children's hospitals in Tennessee. In our region, we only have 10 pediatric intensive care beds. So part of our advocacy for vaccinations, for children wearing masks, is not only to protect your own child, but to protect other children so we could slow the spread of this down and sustain our capacity so kids can get the care. Because keep in mind, it's not just kids with COVID. There's other children who have traumatic injury, who have other types of need for health care that can't get it.
And I want people to know, and I don't want to make this a partisan thing, but just so people understand where you are coming from, you are someone who has advised largely Republican governors and administrations. But COVID shouldn't be political, which is why when I was talking this morning to a doctor from an ICU in Florida, I was asking him, is your government helping or standing in the way now of you saving lives? And he very much feels that government's standing in the way.
Look, I don't think it's any secret. I'm a pro-life, pro-gun, conservative Republican, and Governor Lee in Tennessee is one of the most compassionate people I know. I do believe that our governors are all trying to do what they believe is best. I also believe that as a CEO of a health system, I have a responsibility to advocate for our nurses and our doctors who are, frankly, fatigued. They're overwhelmed, and it's a threat to the public if our nurses begin to develop PTSD and other things that lead to them departing the bedside, then the public's going to feel that. We're seeing it right now with 10 to 12-hour ER wait times as we get backed up because of the short staffing that we're all experiencing all over the country. So I understand the frustration. On the one hand, I don't think we should be political about it. I think we should do our best to give good advice to our leaders and to provide good advice and input and data and facts to the public so they can make the best decisions for themselves.
Alan Levine, I have to say, you have an important voice and you're using it well. I appreciate you coming on this morning and speaking out. Thank you very much.
Thank you. God bless.
Just ahead, a fully vaccinated